With California and the nation facing a growing obesity epidemic, many schools realize the importance of nutrition to improved academic achievement. This workshop will explore how school districts can improve healthy beverage choices for students. We'll cover current nutritional standards for beverages served in schools and the relationship of sugar-sweetened drinks to obesity and other health-related diseases. We'll also discuss how school districts can develop and implement policies that support student health. I'd like to introduce our speakers today. Peggy Agron is the section chief overseeing a number of nutrition and physical activity programs at the California Department of Public Health. She is the department's lead for the biennial Childhood Obesity Conference, the largest conference in the country focused on pediatric obesity prevention. Dr. Christine Wood is a practicing pediatrician in San Diego with interests in nutrition for children as well as the environmental and nutritional impacts on health and disease. She is the author of How to Get Kids to Eat Great and Love It, and a frequent contributor on TV and radio. Rosa Garcia has served as the Wellness and Character Development Specialist for 4 years with Madera Unified School District. She has a BS in Business from St. Mary's College and is currently working on her Master's in Leadership at Fresno Pacific. Nice to have you all with us today. Thanks for being here. Dr. Wood, let me start with you if I might. There's been a lot of research on the relationship between sugar-sweetened beverages and obesity. Give me an indication of what the science is telling us.
Well, sugar-sweetened beverages are actually the major contributor to our caloric intake in our diet here in the United States. And the research is showing and linking the increased number or consumption of sugar-sweetened beverages with an increased risk for being overweight or obese in both children and adults. And when it comes to children, there's been some research also to show that it can increase their risk of obesity by as much as 60%, which is significant. And I think we know here, it's no secret that we have a childhood obesity epidemic. It's national, it's global. Our First Lady, Michelle Obama, has done a wonderful job for creating a national campaign, the Let's Move campaign, which has brought a lot of attention to this. And what we know is that over the last 3 decades, our rates of childhood obesity have increased by, 4 times as much. So it's quadrupled in 30 years, which is really astounding. Today, probably about 1 out of 3 children is overweight or obese. And the other thing that really concerns me as a health professional as far as health risks for our kids is kids born in the year 2000, they have a 1 in 3 chance of developing type 2 diabetes during their lifetime. Now, there's been some national research lately that's shown that, well, maybe we're having a little plateauing of the childhood obesity epidemic, but the problem is we have some ethnic groups that are really highly hit with the obesity problem, and that particularly is in our African American girls and American Indian girls, and our Hispanic males actually have the most severe obesity of all those ethnic groups. So we know that there are pockets of problems when we look at the statistics. As far as the whole sugar-sweetened beverage thing, what I see in my office is I ask a lot of kids about their calcium intake. And because teens are drinking twice as much sodas or sugar-sweetened beverages in general as they are milk, they're not getting enough calcium. And this is putting them at risk for things like osteoporosis. And the other big thing that we're now starting to really realize is that we have a vitamin D deficiency epidemic going on among children. The recent pediatric studies showed that 7 out of 10 kids are deficient in vitamin D, and that goes along with low intakes of calcium-rich foods. So truly we have some problems to overcome when it comes to this whole relationship with sugar-sweetened beverages.
Let me follow up on something you said. Obviously, as you mentioned just a moment ago, you see youngsters in your office day in and day out. Are there concerns that you have beyond just the question of obesity?
Yeah, there's a lot of issues that we're starting to face. I think one of the things we're recognizing is cardiovascular health starts in childhood, probably starts, as a baby. And so we've really got to, set the stage for these children at a very young age. And we know the usual health risks, I think, with being overweight. Cardiovascular risks as far as heart attacks, diabetes, high blood pressure, high cholesterol, You know, those are pretty much everybody knows, but there's a lot of things maybe people don't know. Fatty liver disease is on the increase because of it infiltrates the liver. Asthma can be an increased risk for people who are overweight. And then we also have problems with bone and joint problems, sleep apnea. And then the other real concern that I'm seeing a lot of is the psychosocial issues with these children. Overweight kids can tend to be bullied more, and that puts them at risk for things like anxiety, depression, low self-esteem. And so these kids can have all kinds of problems in a classroom. Things like, you know, being withdrawn because they feel isolated, or some of these kids can actually act out and become disruptive because of the low self-esteem issues. And all these things, actually the bottom line is it affects their academic performance. And we know that kids who are unfit, overweight, have poor academic performance, and that's a real concern. And then one other part, you know, we got to look at the big picture here, is healthcare costs. I mean, this is obviously a big topic these days, is healthcare. And the societal impact of this is huge. And we know that about 17% of our healthcare dollars is spent actually on medical costs related to being overweight. And that translates to about $168 billion, which is a significant cost to us as a society.
Peggy, we know that there have been efforts across the country in many districts and many communities to restrict sugar-sweetened beverages. Give us a little sort of thumbnail background on those efforts so far.
Well, there's actually nationally lots of momentum from policymakers, healthcare providers, public health professionals to put into place policies and practices that reduce access to sugar-sweetened beverages. When we're talking about kids, we're looking at schools, after-school programs, park and recreation settings, child care facilities, where, you know, many times it's just full access to an array of sugar-sweetened products. What we have done recently in California is we just passed legislation that will set beverage standards for child care facilities. That will go into effect shortly. Prior to that, there could have been soft drinks even available at child care facilities. So we are making some progress. In California, we also have passed legislation a number of years ago that took sodas out of schools. And that was landmark legislation at the time. Currently, we can still in California sell electrolyte replacement beverages, also known as sports drinks, in our middle and high school settings. And we know it's a problem that students are still getting more sugar than they need. 62% of adolescents and 41% of children ages 2 to 11 have at least one sugar-sweetened beverage every day.
That's a significant amount from what you're talking about. Can we talk a little bit more about the standards? I know, as you mentioned, California has instituted standards in its school that in many cases are much more stringent than you see across the country. But what are the beverage standards now? What do they call for?
In California, schools can sell the following beverages or have available the following beverages: water with no added sweeteners, non-fat 1%, 2% milk products, juice that's at least 50% fruit or vegetable juice with no added sweeteners, and in the middle and high schools they can sell the sports drinks.
Okay. Now, you mentioned water. I want to touch bases with that because I think most of us, when we think of non-sugar drinks, right off the bat, that's the first thing that comes to mind. But I understand that in some school districts, particularly in low-income school districts, the availability of fresh, clean water has not been available to students. Is that changing?
That is changing. Another landmark piece of legislation for California passed this year that will require, beginning July 2011, school districts to offer water for free in food service areas during meal times for all students. Prior and currently, that's not been the case, and sometimes there is no access during meal times. Frequently, there is no access during meal times to free water. And schools are required to have one water fountain per 150 students in their facilities, but they're not always in the meal areas. And sometimes how they function and how they operate kind of varies from district to district.
Doctor, I've got to believe that just not having the availability of water is a major concern.
Well, it is, and I see problems with that because kids suffer from headaches, and they basically are sort of mildly dehydrated throughout their day. But one of the problems that we see with the whole sports drink problem is that the experts are saying that kids only need it if they're doing an hour or more of vigorous physical activity. And unfortunately, most of our schools, those kids don't see daily hour of vigorous physical activity, so there's no need for a sports drink in the school setting. And what I also see in my practice is a lot of these kids and families are using sports drinks as a beverage for meals and snacks, and we know it has its problems as far as it offers salt that they might not need at that time, and just the added sugars can actually expose them to risk for dental cavities.
Can I show you how much sugar?
Oh, sure. I'd be interested. You've got some props here.
We have some props. So this is a standard 20-ounce bottle. And this, by the way, in middle and high schools tend to be the size that are found in vending machines.
For an average sports drink.
For an average sports drink. And so an average sports drink would have approximately 9 teaspoons of sugar. So that would be 1, 2, 3, 4, 5, we'll get there, 6, 7, 8, 9. So that would be your sports drink. And then if we wanted to get to how much sugar was in a typical soda, we would add 8 more.
Let me hold this for you while you add 8 more.
We will add
then.
8 more. 1, 2, 3, 4, 5, 6, 7, 8. So every time we're drinking a 20-ounce soda, this is how much sugar we're taking in. And remember, kids, the majority we're saying are drinking at least 1 a day, even young kids.
And what strikes me as you did that would be if you're an adult and perhaps you had a cup of coffee in the morning or a cup of tea, the concept of putting in that much sugar would be appalling. I mean, you would go,
Absolutely.
Oh, this could never be. So seeing how much is in the sports drinks and then in the soft drinks becomes just this eye-opener to me. This is
Right.
this is a lot of sugar.
I often do this demonstration for kids and students, and I remember in particular one elementary school I went into, I showed them how much sugar and I measure it out and show them. And the principal emailed me the next week and she said, "You'll never believe how much water these kids are drinking now," because I talked about the importance of water and why we don't need all that sugar. So, we can make an impact if we start in the schools.
Given all of this information and given what we're seeing in terms of what the state is doing in terms of legislation and the like, what do you see as districts doing? How are they responding to this call? How are they responding to this information? Not only the obesity question, but the very fact that you have these sports drinks and soft drinks that are having an impact on their students and how they behave and how they learn.
We have many districts in California that have really been leaders in this area, and some that have been providing free water for some time. For example, Berkeley Unified School District has the 5-gallon water jugs and provides students with paper cups and they can fill up water. Folsom Cordova Unified and Hayward Unified School District have put in filtered hydration systems where, they kind of look like in your fast food restaurants where you go and you put your cup in and kids can go get, really nice cold water throughout the day. We've also seen districts that have eliminated electrolyte replacement beverages, our sports drinks, even though they are not banned. They've realized that they want to provide healthier beverage choices to their students, and we've seen that, to name a few, in San Francisco, Oakland, Berkeley, and Lemon Grove, and I think we're going to hear a little bit about what Madera has been doing in that area as well.
Well, that's a good point. Let me go over to Rosa for just a moment here, because you grew up in the Madera School District. You went to school at a time when the sweetened beverage policy was different than it is now. Give me a little an idea of what it was like then and what it's like now.
Well, back then when I went to school, we were offered, or sodas were offered to the students, and I remember purchasing those sodas. we opted the soda over the water because it was less expensive for us to do that. Now, returning to the district and being an employee of the district, particularly in the health services department, I've noticed that we've adopted a wellness policy. And within the wellness policy, there are certain guidelines that have changed from when I was in school to now.
And we assume those changes are for the better. But let me ask, there must have been some talk about this as you moved to this direction. What was it that the district saw, or what were they seeing that said, oh, we need to change what we're doing to move in a different direction?
Well, we wanted to offer the students a healthier choice in beverages at the middle schools and at the high schools. We noticed that our obesity rates are going up. There's reports, in the news all day, every day, you hear something about obesity. And we've done our own studies at our district, especially with our preschool students. And we recently did measurements with them, and we've noticed that more than half of our preschool students are already overweight. So those are really alarming numbers. And because of that, we decided to make some changes and look at our district wellness policy to make sure we were in compliance.
Now, oftentimes there may be resistance. People like what they have, they like the availability of what they're going so far, and you as a student might have said, oh, wait a minute, I want to have my soft drinks. Was there resistance? What was the reaction?
The resistance came from the students at first. We did advertise and let them know beforehand, a month beforehand, that we will be eliminating the sports drinks from the sales. And once we removed it, we replaced it with a carbonated 100% juice, which at first they weren't taking a liking to it. But once our child nutrition staff started telling the students and informing them of the health risk associated with the sports drinks, they got the picture.
Let me touch on something that I think we briefly mentioned before, but that is, for some school districts across the country, they were looking at this as a money-making proposition for selling beverages in the schools, most of which was soft drinks, sports drinks. What about in your district? What was happening there?
The first time we removed them was this past spring, and during that semester we didn't notice a fiscal impact at the middle school levels because the selling of the beverages was the same, $1 for $1, so we didn't see an impact because the students did begin to buy those carbonated drinks and the 100% juices that are offered. Not noticing that the sports drinks weren't there, then there wasn't a significant fiscal impact there. At the high school level, that's where we saw the fiscal impact. And I believe that's when the beverage company that we have an exclusive contract with, they noticed that we weren't ordering the sports drinks or the other beverages, and I believe that's when they came in and advised us that we were in violation of a contract, which the health service staff was not aware of that we had. But the fiscal impact was at the high school.
Okay. And those sports drinks are still being offered?
Unfortunately, beginning this school year, they are still being offered there, but we did remove them for one semester, but now they are beginning to be offered there again.
And at the lower grades, not being offered?
No. Kindergarten through 6th grade, no. Middle school, no. And high school, yes. But we're working on that.
And I would just add that we've seen that trend across the state where when foods or beverage changes, that there may be a dip in sales initially, but eventually that comes up because students are going to be hungry, they're going to be thirsty, they're going to purchase what's available. So that's not that unusual. It is a little bit disappointing to hear that the beverage company wouldn't work with you in your efforts to provide healthier beverages, because most of them do have a selection of healthy beverages as well.
Yes, they do. But in our case, we're going to start probably some dialogue with them pretty soon and see what can be done, where we can make some revisions, see if they can offer a different drink for our students that's healthier.
You've seen this whole scenario play out from where they were their sports drinks and sugar sweetened beverages to a very limited amount there. Mm-hmm. What other advice could you offer other districts looking to make these kinds of changes?
Look at your wellness policy and make sure you're in compliance. Work closely with district administrators, with the board, and with your food service director. They're the ones who make the decisions at the end of the day anyways. And as long as you have the buy-in from them, then it would be easier because it's board policy. You don't want to be violating your own policy. And as long as you're in compliance and you get that into the board policy, then it would be easier. Also getting the parents' support. I've attended a couple of meetings with parents. I would go out there and advertise the fact that we were going to be changing the sports drinks. And a lot of them were astonished at they weren't aware of all the sugars that these sports drinks contained. And hopefully in me going out there and teaching them this, then they would also make a change in their homes, just like Dr. Wood was talking about earlier, making that lifestyle change at the home, as well as, since we're already starting it in the schools.
No, go ahead.
Yeah, and one other thing that I see is when we incorporate these changes at a young age and that becomes the norm, it sticks. But when, I know when I worked some local wellness policies in my school district for the elementary, and at first there were some tough decisions that came about, no cupcakes for celebrations and things like that. But now this generation of kids that's going through and started with kindergarten there, they don't know any different. So they're agreeing to it and the parents are agreeing with it. So I think we have to start with the grassroots, everything from infancy to preschools, as you mentioned, through our schools, and just carry it through. And then we'll have some success in this whole arena. Which
kind of brings me to my next question, Doctor, which is, if there are these movements or if there are these concerns to go in this direction, how can one support these efforts in the community or at the school district level? What would you suggest they do?
Well, as a practicing pediatrician in my community, obviously I work individually with a lot of families and kids on the whole nutrition problem that they may be facing. But I also recognize I can only do so much in my office with some of these families. If I'm giving advice to a family and they live in an area where there are no large grocery chains, they don't have access to lots of fresh fruits and vegetables, they may have high density of fast food restaurants in those communities, and I'm telling them, go eat more fruits and vegetables, I'm not going to be effective as a person to give them that kind of advice. So I do feel that we need to create advocacy, and that's something I'm really passionate about in our community because we've seen that we can make some changes. For example, if you look at school wellness policy and you're looking at sweetened beverages and the contracts that you have, you're also looking at vending machine policies, celebrations, etc., and you're setting policies, then I know when I'm giving advice to these students about what they should be eating at school, I'm getting support in the environment. And that's huge for me as a pediatrician trying to give advice to these families. And it has to involve lots of people. I'm the co-chair of our San Diego County Childhood Obesity Initiative, and we have partnerships that myself as a healthcare person, I might not have even thought I'd be exploring, but our partnerships in here include healthcare, but it also includes government, transportation, parks and rec, media and marketing, businesses, childcare, faith-based organizations, youth-based organizations, schools and after-school programs. And it's amazing the kind of projects we can come up with when you're talking and partnering with these different sectors, and how much more effective it is in a community if we can interface in that kind of way. And it's not all about that everything works. I think one of the first earliest learning experiences I had was I got asked in early 2000s sometime to go and talk to one of the school districts about their soda contract and try and encourage them not to renew that contract because it was up for renewal. And I thought, yep, I'm going to do my little 3-minute presentation and we'll do that. And it wasn't successful. But look at where we are today. Now we have policy in legislation here in California that limits a lot of these choices. And I feel like, we're paving the road. And it's a tough road to pave, but we have to start somewhere. And this is really the message we hope we can all get across, is that, we got to work together as communities and not blame one sector or the other.
And you were going to say, but I wanted to say that this is, the one step at a time seems to be something that's working quite well.
Yes, and I would also add that parents and school staff, we talk about wellness policies because we're all engaged in this as part of our, passion about this work. But if you ask teachers or parents, most of them don't even know that schools are mandated by the federal government to have a school wellness policy that addresses the foods and beverages that are sold at schools. So I would encourage teachers, school staff, parents to ask their district, what is our wellness policy? Where is it? Because you don't know if your district's even in compliance with what they have written if you don't know that the policy exists and what it contains. So I would really encourage folks that are interested in this to really ask some questions and find out, and parents are as part of that mandate, supposed to be involved and engaged in this process.
Thank you very much. This has been very informative. I appreciate your time today talking about what seems to be an increasingly important topic for families and communities all across the country. So thanks very much. There is a lot to think about and consider. There are additional resources available on this topic. To access those, log on to the California Project Lean website at californiaprojectlean.org. Thank you for being with us.